If you are diagnosed with a serious illness, like cancer, you will want to find the best treatment for you. Sometimes that treatment is a cancer clinical trial. A cancer clinical trial is a research study that looks for new ways to prevent, find, and diagnose and treat cancer. Clinical trials are important. They're the main way to find new and better treatments for cancer. But to get effective new treatments, more people need to participate in clinical trials, especially those from diverse backgrounds. Your doctor may recommend a clinical trial to you. If your doctor hasn't mentioned one, you can ask your healthcare team if there are any clinical trials that might be a fit. You can also look for trials on your own. There are many resources in the cancer community to help you find a trial. Some are specific to the type of cancer that you have. Triage Cancer can connect you to those resources. If you find a trial you're interested in, you should talk to your doctor to see if it's a good fit. Some people worry about participating in a clinical trial because they think that they won't receive the best treatment. Others think a clinical trial is only an option as a last resort, after they have tried all the other available treatments. But clinical trials might be the best treatment for you right now. You don't have to wait to try other treatments first. Once you have found a clinical trial, you then have to find out if you qualify. Every clinical trial has specific rules which can include things like gender, age, type of cancer, stage of cancer, other treatments you may have already had. The trial also may be limited to a specific number of people. If you don't meet those requirements, then you may not be able to join the trial. If you find a trial that you can't join and your doctor recommends that treatment for you, there may still be a way to get access to the treatment. The U.S. Food and Drug Administration, or FDA, has an expanded access program where your doctor can apply to get the treatment for you outside of the clinical trial. If you are ready to join a clinical trial, the next step is to find out what it will cost. That includes finding out what your insurance company will pay for and any out-of-pocket costs that you might have to pay. If you have private insurance through your employer, the marketplace, or a plan that you bought on your own, the Affordable Care Act, also known as Obamacare, requires your insurance company to cover any routine costs of participating. Routine costs are costs that you would pay if you were getting standard treatment, including when you visit the doctor's office, get a blood test, get an imaging scan like a PET scan, get medications to help with side effects of treatment. Routine costs often include everything except the treatment being tested, and that is usually paid for by the clinical trial. Medicare also covers the routine costs of participating in an eligible cancer clinical trial, and so do military and veterans' health plans. If you have Medicaid, it's up to your state's Medicaid program to decide if they're going to cover the routine costs. You should talk to your healthcare team about whether Medicaid will cover them. As you are deciding whether to join a clinical trial, ask your healthcare team about other costs that you might have. For example, how often do I have to come to the healthcare facility? Do I have to take extra time off work because of appointments or side effects from treatment? Do I need childcare or care for an aging parent? Will I have increased transportation costs like gas or tolls? What does it cost to park at the healthcare facility? Is there public transportation nearby? How long does the trial last? Keep in mind that you might have these costs when getting treatments that are not in a clinical trial. Cancer clinical trials might not be a fit for everyone, but they may be for you. For more information about clinical trials, visit triagecancer.org. This video was funded by the Metastatic Breast Cancer Alliance.